Change can be disruptive, but Business Daily has got you covered from Monday to Friday. Get evolving trends, ingenious business ideas, and the latest tech content in the new market dynamic, and exciting lifestyle content in the new normal environment. Business Daily. More possibilities.
NTV, turning on your world.
A very good evening and welcome to the Nation Leadership Forum with me, Smriti Vidyarthi. In this edition, we focus on violence against children. The deeply saddening reality is that thousands of children countrywide are subjected to violence. And this comes in the form of physical violence, emotional and mental violence, and also sexual violence. But these are innocent children who deserve to be nurtured and protected to live in a safe, secure and happy environment. Now, while there are efforts to prevent violence against children in Kenya, more always needs to be done. So joining me now to understand the complexities around the issues are my guests. Simon Chelugoi, the Cabinet Secretary in the Ministry of Labour and Social Protection. Also, Dr. Mercy Mwangangi, the Chief Administrative Secretary in the Ministry of Health, and Kenya's UNICEF representative, Maniza Zaman. Thank you all so much for joining me on the Nation Leadership Forum. You too can be part of this conversation. Just tweet us at Smriti Vidyarthi or at NTV Kenya. Now, the government of Kenya launched both the 2019 Violence Against Children, or VAC survey, and the 5-year National Prevention and Response Plan on Violence Against Children 2019 to 2023 in the midst of this COVID pandemic. Maniza, I'll begin with you. How are we doing as a country when it comes to protecting our children? Are they getting justice?
Thank you and good evening to you and to the viewers and CS and Dr. Mwangangi. Pleasure to be with you and on this important panel. Before I zoom into Kenya, Smriti, let me just say that actually this whole issue of violence against children is a global issue. And what our global data is actually saying is that about 1 billion children worldwide suffer from some form of violence every single year. I mean, that's a staggering figure. And yet, as you rightly said when you started off, is that, we, nations, communities, parents, citizens have an obligation to protect children. That is their right. And in fact, this right is enshrined in the Convention of the Rights of the Child, which so many nations have signed up to. So really, it is a global problem, and it shouldn't be, because we are all responsible. We all have something that we can do to prevent this. When it comes to Kenya, you've just talked about the survey that we have launched with the government, actually has launched this year. And this was the second time such a survey was done in Kenya. And if you compare the 2010 data to the 2019 data, things have improved. But having said that, when you still have 50% of the children in Kenya who have suffered some form of violence in childhood, that's just too many. That's just too many. And this is why I'm so glad that we're having this discussion in terms of how we can collectively do so much more on this particular issue. Thank you.
All right, thanks. Some staggering and concerning statistics there. Mr. Chalugoi, I'll bring you in now because the Ministry of Labour and Social Services is essentially the main focus point where people head to when cases are reported, and the Department of Children's Services falls under your ministry. What is it that you have found are the reasons for children being violated and abused, and who are the perpetrators, and where really is this happening?
Thank you very much for this opportunity. I want to first acknowledge the participation of the CAS and Manisa, the UNICEF director, and our big partner in child protection. Now, children have been violated by many actors or players. Last year or this year, we released a survey on violence against children, and we found out majority of our children are violated beginning from their homes, one by norms that we continue to practice, which occasionally or other communities take it as normal, where they beat their children, corporal punishment. That is one form of violence, and this has led to boys and young men moving out of their homes to streets. Another form of violence is psychological torture, where children have been abused, and occasionally children feel useless, and this has affected them. There are other forms of violence like molestation in schools and molestation by peers. And the other one, the bad one, is sexual molestation of both men and young boys and girls. This has led to high pregnancy levels in some communities, which they agree that children could be married early, could be married off, and because of those cultural practices, we have seen violence rise in those communities. And finally, child labor. In pastoralist community, children are involved in farming and also in taking care of cows. And this has led them to leaving school, or instead of going to school, they are engaged in child labor. So these are the areas of, these are some of the violence children have gone through. Now, in our survey, we've seen the rise in number of, also we have seen these children who have been violated move to urban areas. And this has led to another problem where we are dealing with street families and children. And we also released another survey on the number of families and children who are living in our streets. And we found that to number 47,000. The intention of all this survey is to first understand how many they are and how do we integrate them back to the communities or institutions of government.
All right,
so,
thanks. Go ahead.
As a government, we are committed to ensure that we reduce this violence against children. We protect them. We come up with policies, laws, and programs that addresses some of the underlying issues that pushes or exposes children to violence. And we've continued to engage our children officers, working together with various partners to ensure that this vice is reduced and brought down. As a ministry, we are committed to reduce the level of violence against children by 40% by 2023.
Chalugoi, thank you, and we'll get into the details of some of those issues and commitments that you raised. But it seems like violence against children is oftentimes caused by economic hardship, as you mentioned, cultural practices, societal behavior as well. in some communities it is expected, it is the norm, I should say. Dr. Mwangangi, I'll bring you in now because female genital mutilation is also considered as violence against children, and we are still seeing it in the country despite the president saying that by 2022 FGM must come to an end. Parents are now taking their children to hospitals or clinics to get their children cut. What is it that the Ministry of Health is doing to stop their medical staff or clinic workers in participating in this form of violence against children?
Thank you. Thank you, Smriti, and thank you to CS Chalibui and Maniza for joining us in today's panel. Let me begin by really, agreeing with you, Smriti, that FGM is perhaps one of the most should I say, really, really severe forms of violence that's mitigated on children. And as a Ministry of Health, we have taken note that some of our health practitioners, be they doctors, be they nurses, be they clinical officers, are actually participating in this, and therefore, of course, causing parents to be able to move to hospital care settings and have the procedure done there. And so the last time we conducted a survey about 2014, and this is some time back, the survey did tell us that in terms of medicalization of FGM, we're at about 19%. And really, that's a staggering figure to know that the health sector actually contributes to this act of FGM, which, as you know, is actually illegal and is a criminal offense in the country. And so as a Minister of Health, we've heard the clarion call from the president, and we have set up what we call guidelines and regulations that will actually look at the code of ethics when it comes to the licensure of the different practitioners. We are working with the Nursing Council. We are working as well with the Clinical Officers Council and the Kenya Medical Practitioners and Dentists Council. And all these councils are the main regulatory bodies and agencies who give licenses to practitioners. And so we do have guidelines now that can actually offer penalties, that can actually lead to the retraction of licenses, which will then, of course, make some of these practitioners unable to practice. And that is one way in which we're sort of trying to enforce and to reduce, the rates of medicalization of FGM. We are also extending this further into training. We've noticed that some of our healthcare workers, particularly those who may come in communities or cultures that do conduct FGM, do require, some form of capacity building for them to be able to understand, the ill effects of FGM, and for them to also be able to, should I say, be champions even within their own communities when it comes to reducing the rates of FGM. And so we're really working, we feel, as a Ministry of Health and as a sector, if we pivot around the healthcare worker, we should be able to, again, mitigate and reduce the rates of FGM. We've also extended our reach to our community health volunteers. These are members who support the Ministry of Health and the health sector and who are members of different communities. And through this mechanism, we're rolling different advocacy campaigns with them. In fact, one of the most recent advancements would be that we've rejigged the training model of CHVs, whereby we now have a training model that touches on FGM and is able to then, of course, educate these community champions to be able to get into their communities, to talk to the different members of families, the different village elders, and be our advocates when it comes to stemming down FGM.
All right, thanks very much, Dr. Mwangangi. Now, of course, there have been successes, but also challenges, and the whole world was thrown into disarray with the COVID-19 pandemic. It's shaken the world in numerous ways. Maniza, how has the coronavirus pandemic impacted cases of violence against children? Because we here in Kenya did at one point believe that our children were safer at home rather than in school, but turns out that's not really the case, is it?
Yeah, as you've just said, I think COVID-19 is definitely a curveball, that came to all of us in the world. And certainly one of the things that we have been extremely worried about is what's called the shadow pandemic, which is a rise in violence against children, gender-based violence, and so on. And we have seen this globally, unfortunately, but we've also seen it in Kenya. The data has been showing us that basically the cases, as was just mentioned in terms of FGM, has increased. This year, child marriage, reported cases of child marriage have increased this year. The calls that we get through the child helpline has also increased. So in fact, as much as we had hoped and we wish that home can be a truly protective environment for children, as was just mentioned by the CS, we do see that often the violence is perpetrated by people, family members, unfortunately, community members who are known to children. So I think we've got to keep an extremely keen eye on this. Yes, of course, families are under stress. Yes, of course, there are anxieties, livelihoods are being lost, and that can bring a lot of tensions in the home and in communities. But that does not mean, or that is no excuse for allowing those emotions, that anxiety, that worry to come out in any kind of violent form when it comes to children. Children are just as anxious in terms of understanding what's happening with COVID-19. Precisely at this time, they need everybody's understanding. They need patience. They need love and care, and they need extra nurturing. So it is really a shame to think that we're now getting a spike of violence against children and gender-based violence as well during these troubling times.
All right, well, one preventative measure that we know of is the existence of child protection officers. But CS Chalugui, the fact is that we simply don't have enough child protection officers in the country, and where we do have them, there are hurdles which perhaps prevent them from doing their optimum work. We're also struggling with a social service workforce that's large enough to attend to these issues of violence against children. My question to you is, why don't we have enough child protection officers, and what's being done to ensure that we have more men and women or boots on the ground?
Thank you so much. It's true that a number of counties, sub-counties have been created in the recent past, and we've not been able to post children officers. However, following the revelation of this survey, Violence Against Children, as a ministry, we are working hard with the Public Service Commission to recruit new officers. We already have 284 sub-county children officers and 47 children coordinators across the country. And we have currently 290 sub-counties. So as a government, we are committed to ensure that we recruit and post officers across. There are also other challenges that they could be facing in terms of one sub-county or a county could be so big for one officer to man, and considering the number and incidences of child abuse, one officer may not be able to man. But with the use of technology and through multi-agency approach, we could be able to ensure that all our children are protected. Now, even during, I've had Manisa speak, and I really thank her for our partnership support. She has been with us in every step of the way. And I can confirm to you, the Ministry of Labour and Social Protection and the Government of Kenya has been, even despite the outbreak of this pandemic, we have continued to ensure we coordinate and even increase our working relationship with our 47 county coordinators and the 284 sub-county children officers. And through multi-agency approach, the Interior, the NCAO team, Office of Director of Public Prosecution and DCI, we are now, and DCI or Ministry of Interior have also come up with a joint team to enforce some of the violations that our children officers find. We're also working on making sure that we can decongest during this COVID all the institutions that have been hosting children, so that where we can integrate them back to their communities and families, then we are able to do it. And finally, collaboration with partners like Joint Forces Alliance, where organization and donor organization that are involved in children protection, like Child Fund, Plan International, World Vision are all mobilized to support, and they are also spread across the country, and they have been very helpful as far as children protection is concerned. Then finally is mobilizing resources to cushion children and families during this COVID, and ensuring that even the officers, the county commissioners, the deputy county commissioners, the chiefs and assistant chiefs are sensitized by coming up with documents and booklets and catalogs and information flyers that helps improve the messaging around child protection.
Thank you. Clearly, a multi-sectoral approach is required. Before we take a break, I've just got a question for you, Dr. Mwangangi, because while there aren't enough child protection officers on the ground, we do have community health workers on the ground. Again, possibly not enough, but how are they addressing the issue of violence against children? You may have touched on it earlier, but what role are they playing in protecting the children?
Thank you, Smriti. So we do actually have a very strong network of community health volunteers. We have about 100,000 of them distributed in each county in the country. And I can say that perhaps this is a bedrock force when it comes to the health sector. During the COVID-19 response, the community healthcare volunteers were actually instrumental in passing on, risk communication messages in the community. And in the same breath, we are actually utilizing them for what we're calling a Tujulishane campaign. And this is a campaign that is, targeted to community members to be able to, one, raise awareness when it comes to the ills of violence against children, but also to create platforms where the community feels the responsibility, which they do have, of coming forward and reporting cases of violence against children. And so our community healthcare volunteers are all over the country working primarily on advocacy and communication, but also when it comes to identifying, vulnerable families who may actually, end up having situations of violence against children within their households. So a very instrumental workforce, one that is well-trained. Like I said earlier before, we've actually put in place a specific training module for them to be able to understand the ill effects of FGM, for them to be able to understand all the other different presentations of violence against children, including mental health, physical abuse, and all the other variants of violence that are meted against children. So a very, very worthy and very instrumental workforce, 100,000 strong.
Okay, all right. Well, thanks for that. And you mentioned vulnerable families, and that's where we will pick up when we return from this break. You're watching the Nation Leadership Forum. We're not going anywhere, neither are my guests, and you should stay tuned too. We'll be back in just a moment.
Geisha coconut milk and honey, enriched with coconut milk for soft and moisturized skin.
Be strong and last long.
For an exclusive fragrance experience, try Nivea Men Deep Impact Body Lotion with a long-lasting woody fragrance, deep moisture, and a fresh skin feel. Make an impact with Nivea Men Deep Impact. Nivea Men, it starts with you.
Rock Plastic Tips. Rock plastics are made with 100% virgin raw material. Rock plastics come with new and different unique designs.
Rock Industries brings you rock plastic with a variety of kitchenware, ranging from kitchen dishes, cups, plates, clothesline pegs, spoons, and even rulers for learners. These and more products, contact our offices on 0722 575619 or 0736 028181.
Do more to protect yourself and family from viruses that remain on the clothes. Separate laundry that has been exposed and do not shake to minimize the possibility of dispersing the virus through the air. Soak soaking your laundry in water and hand washing powder does more to kill germs than just a normal wash. After washing, dry your clothes in direct sunlight.
They say we do the expected. We say we're more than you expect. Sunlight, more than you expect.
Kila siku unapokaza mshipi, unapozidi bidii, unapoongeza maarifa ya kuimarisha maisha, unapoongeza nguvu ya kukusongeza mbele, unaposherehekea na kuwakaribisha wengine kufurahia nawe, unapojijenga kibiashara na kuonyesha penzi lako, unga unaozaidisha uko papo hapo, kuzaidisha utamu wa maisha kwa kila namna, kila mara. Familia ya Ajab imeongezeka ili uzidishe mapishi. Mambo ni Ajab.
Every spoonful of Nutri comes loaded with the necessary vitamins, protein and minerals for you and your family to become healthier and stronger. Pick up a pack today from your nearest store. Nutri, every spoonful counts.
Thanks for staying with us. This is the Nation Leadership Forum, and tonight we are focusing on the topic violence against children. My guests today are the Cabinet Secretary in the Ministry of Labour, that is Simon Chelugui, and also Dr. Mercy Mwangangi, the Chief Administrative Secretary in the Ministry of Health, and also the UNICEF representative in Kenya, Maniza Zaman. All right, we left off on the point of vulnerable families, and a lot of the time violence, especially in the home, is triggered by economic struggles. It's due to desperation and poverty as well, and therefore frustration, which is perhaps let out on those innocent children. The Ministry of Labour and Social Protection is responsible, Mr. Chelugui, for cash transfer programs, for example. What is the ministry doing to support vulnerable families with perhaps economic stimulus programs to prevent that violence against children?
Well, thank you very much. Many parents struggle to take full parental responsibility as they strive to improve economic situation, and the lack of knowledge on positive parenting and negative impacts leads to impacts on violent discipline. So according to 2019 Violence Against Children survey, about 1 in 3 females and 2 in 5 males have reported parents or adult relatives as perpetrators for the first time on incident of physical violence. So the survey confirmed the association between food insecurity and violence, where 39.6% of females and 41.3% of males have experienced food insecurity, and these are ages between 18 and 24. Now, according to World Health Organization, parenting and caregiving support programs have been identified as a promising strategy in ending violence against children. Now, to cushion families from these effects of poverty and economic challenges, the government of Kenya, through the Ministry of Labour and Social Protection, have been running a program called Inua Jamii. And this program targets 2 levels of groups of our society, Kenyans. One of them are children, vulnerable children, and we are supporting now over 353,000. These are orphans or children who have been abandoned, or their families are not able to care for them. And through the chiefs and assistant chiefs, the Nyumba Kumi, we've been able to map out across the country 353 is a small number, but this is we are able to take care of majority of vulnerable children. Through the same Inua Jamii program, we are supporting senior citizens, and currently we are supporting over 833,000 senior citizens, and also people living with disability. So by this government of Kenya injecting over 26 billion Kenya shillings annually, we are able to cushion and minimize the impact or effects of violence against children. This program is currently, we want to enhance the impact, we want to progress and increase the number of those we cover. As we speak now, a number of these groups, children, senior citizens, people living with disability, the last survey was done in 2017. And the current budget that cannot support all the registered members. As a ministry, we have come up with a bill, Social Assistance Fund, which is now before Parliament. And we expect when this bill is enacted, we will be able to open a window for other willing donors. UNICEF is willing to inject in some money, World Food Program, World Bank, and that way we can be able to roll out a universal coverage across the country, across all the counties in Kenya. And that way, all our children will be protected, or rather they will be supported, and we will be able to minimize the effect of violence against children.
As I said at the top of this forum, things are being done, but more can always be done. And the prevention and response to violence against children, Maniza, cannot fall under one ministry alone. Perhaps the Ministry of Labour and Social Protection is the parent ministry, but we need coordination amongst relevant ministries. Are we currently seeing strong coordination among the ministries, such as the Ministry of Labour, the Ministry of Health, the Ministry of Gender as well, and also the institutions such as the police and the judiciary as well? How would you describe the multi-sectoral approach at the moment? Because it seems, according to the CS and also the CAS, that working together is happening, but is it enough, in your opinion?
Let me first of all also take this opportunity really to support what the CS has just said. And actually a couple of things the CS has said. One is that earlier on in his comments, he did talk about this multi-sectoral committee that's coming together to take forward the National Plan of Action to prevent violence against children. Because if you look into that plan, there are actually roles for several ministries, including the ones you've just mentioned, but also Ministry of Interior, Ministry of Education, and Judiciary, and so on. And I have to say that as the plan was not only being formulated, but also now that it's there, it's being costed out, roles and responsibilities are clear, the ministry has taken really strong leadership to bring in all the partners together, and also bring in the county levels so that we can have that level of coordination that is absolutely needed to have an effective response, but not only a response, effective prevention strategies as well. So I think Kenya is certainly in a good place. When we look across the region, there are a few other countries that are able to do this effectively. Multi-sectoral coordination takes effort. It is work, it doesn't just happen, but importantly, there is very, very strong political will here, and from where we're sitting, we do see this, and we work very closely with the Ministry of Labour and Social Protection, as with the other ministries actually as well, and so we are able to witness that on a day-to-day basis. So I'm really hoping that this leadership actually continues in this way. We also see that happening and mirrored at county, sub-county levels, etc. It's only by working together that we're going to be able to address this issue. If you allow me, I just want to say one other thing that the CS has just mentioned in terms of the absolutely clear linkage between social protection and child protection. You're right, it is often the most vulnerable and impoverished families who are struggling to make ends meet, who don't have, I guess, the bandwidth, so to speak, to actually look after their children and care for the children in the way that they would wish to. So that linkage is really important. And what the ministry has been also very open to, and I want to appreciate this, is what we call cash plus program. So yes, it is cash to vulnerable groups and families, but it's also adding on to it, for example, education and parenting tips to those families. So it's not only cash that's going in, but it's also some other support that those families need to know how best to nurture and look after their children. So there's some exciting work happening. Of course, we wish it could happen faster at a bigger scale and we could see the impact and so on and so forth. But I do feel that in Kenya, we're really heading in the right direction.
All right, well, that is positive news. Dr. Mwangangi, when children and women, young girls, young boys even, head out for a medical checkup, is enough done during those checkups to check on the general welfare and well-being of those children? Are they cross-examined about any potential violence that they have faced, or is it a case of a child gets her heart rate checked and her blood pressure checked and everything's okay, and then off they go? Does more need to be done during such consultations?
Thank you, Smriti. You bring up a very important component when it comes to examining a child who has come in for any other medical condition. And perhaps even before the child gets sick, when the mothers are bringing the children for child health clinics, for immunization services, and all the allied services that a child would require, it becomes very important to ensure that there's integration of care in terms of can the nurse actually conduct a good physical examination? Two, do we actually have a psychologist or a child counselor who is able to notice those telltale signs that usually exist? Is the mother looking a little bit, uncomfortable in terms of her relationship, her interaction with the child? All these are things that can be picked up. And like you asked, could more be done? Yes, indeed. Definitely more could be done. And we are working towards that. For example, the Ministry of Health has most recently recognized the roles of psychologists as a necessary cadre and resource in the health sector. And so going forward, we now will have psychologists placed in different healthcare facilities in different departments so that they can be able to pick out cases that require care.
And how
so indeed,
soon might we see that?
Very important component.
How soon might we actually see psychologists in those clinics present when children are getting a checkup?
So during the COVID-19 pandemic, perhaps the silver lining of the COVID-19 pandemic would be that we've recently employed about 47 psychologists into our health sector. So we have about 47 of them who've been posted. Of course, these guys are not enough. 47 is not enough. We have close to 8,000 facilities in the country. And so you would need a really large workforce. But what we want these psychologists to do is to be able to collaborate with the children officers, with the social services officers who are under CS Chelugui, who's present here today, and to be able to, create frameworks, how they can extend some of the skills that they have, even to our nurses, some of the skills that they have to our midwives, some of the skills that they have to our clinical officers, to be able to ensure that, we're building on the workforce. But I hear you, indeed, now is the time to really act, to be able to put this resource on ground, because it's one that is quite necessary. But I would also like to add on to what Maniza and CS Chelugui said. Through the Universal Healthcare Coverage Program, we're hoping to extend that social safety net to vulnerable families. And I can already see here, mechanisms through which the two ministries can collaborate when it comes to setting up of the Universal Social Protection Fund, as well as setting up for the UHC fund. Perhaps even in some countries, best practice has been to have, a combined integrated fund for the two. And this will go a long way in ensuring that vulnerable families are protected from financial stress when it comes to seeking healthcare services. And then, of course, getting the social safety net and that security that they require. So thank you, Manisa. And thank you, Smriti.
All right, thank you. CS Chelugoi, now a children's bill, that is the Children's Bill 2018, is in existence, but it has been pending despite some progress. Why is there a delay, and when can this be expedited and adopted?
Thank you very much for this opportunity once again, and I am also following very closely what my two other speakers are saying, the CAS and Manisa, and I think they are speaking to the realities of today as far as children protection is concerned. Now, Children's Bill is an improvement, it's a progressive bill and reflecting on the realities of today. And the Children's Bill 2020 has gone through the whole cycle. It has been given the widest public participation across the country, and because children matters are very emotive, we have had experts, we have had members of parliament, communities, churches, religious organizations, judicial, the whole criminal system, those who are involved, social officers, parents, children themselves have contributed to the making of this bill. We have also borrowed a lot, benchmarked, and enhanced this bill, and we have had contribution from partners like UNICEF, who are also engaged in children matters. We have taken into consideration the African Charter on Children. We have also taken into consideration United Nations Convention, and also our current, our cultural norms and practices. This bill talks about rights of children, but it also speaks about the responsibilities and duties, not just the rights. We have so many rights provided for. This bill has the first chapters on definitions, so that we don't misinterpret, or when we are handling matters of children, words are not used to confuse in terms of protecting children. And the other chapters have also been, adoption issues are there, caregiving, foster care institution, criminal process of protection of children, and trafficking. So this bill has recently gone through the PSS committee. It has been approved. I have also delivered before the Committee of Cabinet. It has been approved, and now we are awaiting the final stage of the Cabinet, and it is on its way to Parliament. The commitment and the mobilization we have done, I can see this bill going through in Parliament much faster than many other bills which are queuing. So my estimation is by March.
Yeah, go ahead. Sorry, I was going to ask.
My estimation is by March, we should have the bill in place, and we will be able to, even our leader, our president, is ready to sign, is fully seized of this bill, and is tracking and following, because this is a revolutionary bill as far as children matters are concerned. So we should have the bill by March of next year.
All right, thank you. And we will certainly check in with you on that, as I'm sure UNICEF will as well. Manisa, just tell us, how will fast-tracking this bill really impact and improve the situation? Why do you see it as so imperative and urgent?
Thanks for this. I mean, as the CS had said, of course, a lot of these bills that nations come up with are very much pegged on the Convention of the Rights of the Child, which came into being in 1989. It's 31 years ago. Things have changed, circumstances have changed, new issues have come up, children face different threats, new threats. And so it is important for all countries to look at what they have to update these kinds of legal instruments and frameworks. And I'm really, we've been working hand in hand with the ministry on this, together with many other partners, and we're really looking forward to this now coming to fruition, as the CS said, by around the first quarter of next year. It is important to have these kind of really, really clear legal frameworks, because otherwise you can get misinterpretation, roles and responsibilities are not clear, you can get loopholes. And it is often through these loopholes that we are seeing that we're not really able to do justice to the issues in relation to violence against children, or, as the CS said, matters of adoption or any other issues. So I think having this robust legal framework is going to be instrumental for Kenya to, take further steps and again be one of those countries that has looked at how one modernizes and stays current with the situation. So we're really looking forward to this.
Okay, thanks very much, Maniza. At this point, we've got to take another break on the Nation Leadership Forum. But as I said earlier, do stay with us because there's still plenty more to discuss on this key topic of violence against children. We'll be back in just a few.
To help fight the spread of coronavirus, learn Lifebuoy's hand washing habits. Wash hands with soap or use an alcohol-based hand sanitizer. Together, let's help fight the spread of coronavirus in Kenya.
Every time Gran arrives, she always has a small reward for her.
I made this for you today.
Ah, thank you, my baby. It's so beautiful.
Wow!
She's happy, and I trust it because it's made with milk and other carefully controlled ingredients without any colorings or preservatives. Care has been taken to make it. I love to see her happy because it meets her taste and fantasy. Kinder Joy, my trust, their joy.
Do more to protect yourself and family from viruses that remain on the clothes. Separate laundry that has been exposed and do not shake to minimize the possibility of dispersing the virus through the air. Soaking your laundry in water and hand washing powder does more to kill germs than just a normal wash. After washing, dry your clothes in direct sunlight.
They say we do the expected. We say we're more than you expect. Sunlight, more than you expect.
Kitisuru Amani Gardens apartments located near the International School of Kenya are almost complete. American kitchen with featured cabinets, solar panels, bedrooms with an ensuite master bathroom, swimming pool, gym, backup generator and borehole, among other features. Call us. Our Kenyan number is +254 733 926 935. In the USA, call +1 205 948 7797. Kitisuru Amani Gardens apartments, where elegance and luxury meet.
Union Pay cards are widely accepted at POS and ATM nationwide. Union Pay cards can also be widely used for e-commerce payments. These and many more local and international merchants accept Union Pay. Hey Kenya! It's time to earn while you spend with your Union Pay card. Yes, you get 10% back on every purchase, rewarding you as you swipe. Union Pay, your way.
Man, you got to have game. When it's all sweat, pressure and anxiety, yet that's just halftime. Stay cool and in the game with Imperial Leather for Men range. Wear luxury. A little luxury goes a long way.
When the world changed, it made us go back to the simple joys and love the little things even more. Like serving up your best, eating together and sharing more. Now, we'll take nothing for granted and always remember to taste the simple joys.
Enjoy the magic of Christmas with Coca-Cola.
Renata just left. According to her, it's to see some friends from work, but she was dressed to the nines.
No, you're not. You're not fine. Hey, Roberta!
That was Geronimo. No, he's back in Spain.
Did you say
it seemed like she had a date?
Yes.
I saw Renata and Geronimo chatting outside the bathroom.
Did you hear anything?
I didn't hear. I just wanted to let you know.
I will never forgive you for this, Renata. This time around, you've signed your own death sentence yourself.
A veces desespero
This is NTV.
Tonight, the mystery of the little-known farm swimming in Kemsa millions.
On behalf of the government, you should be thanking our company, but not like demonizing the way the media and we've done a big job.
Shop and Buy Limited was just 2 months old when it won Kemsa tenders. Also tonight, what's the Deputy President's BBI game plan?
When we talk about the possibility of us having a multi-choice referendum, we are not talking about something in space. We are talking about a reality.
Also why he wants the referendum pushed to 2022. Plus, ahead of tomorrow's date with fate, Nairobi Governor Mike Sonko rallies allies to his side.
If you have the numbers, aluta continua. Kesho tupatane.
And also tonight,
the safety of the public will always come first.
A dose of hope for the world as Interpol warns of vaccine profiteers.
To help fight the spread of coronavirus, learn Lifebuoy's hand washing habits. Wash hands with soap or use an alcohol-based hand sanitizer. Together, let's help fight the spread of coronavirus in Kenya.
Exclusive fragrance experience. Try Nivea Men Deep Impact Body Lotion with a long-lasting woody fragrance, deep moisture, and a fresh skin feel. Make an impact with Nivea Men Deep Impact. Nivea Men, it starts with you.
When the world changed, it made us go back to the simple joys and love the little things even more, like serving up your best, eating together, and sharing more. Now, we'll take nothing for granted and always remember to taste the simple joys.
Enjoy the magic of Christmas with Coca-Cola.
Do more to protect yourself and family from viruses that remain on the clothes. Separate laundry that has been exposed and do not shake to minimize the possibility of dispersing the virus through the air. Soaking your laundry in water and hand washing powder does more to kill germs than just a normal wash. After washing, dry your clothes in direct sunlight.
They say we do the expected. We say we're more than you expect. Sunlight, more than you expect.
By the way, Carl, Mother will be visiting us this weekend.
Believe me, I'm counting the minutes. Eureka!
Red Bull gives you wings.
In Kenya, 1 in 2 children suffer from cavities. Brushing with Pepsodent removes bacteria and repairs tiny holes before they become cavities. Because every smile matters.
I wish I could have soft and glowing skin.
New Geisha Black Soap. With activated charcoal to give you soft and glowing skin. New Geisha Black Soap and New Geisha Moringa.
Every spoonful of Nutri comes loaded loaded with the necessary vitamins, protein and minerals for you and your family to become healthier and stronger. Pick up a pack today from your nearest store. Nutri. Every spoonful counts.
Leadership Forum with me, Smriti Vidyarthi. Now, Dr. Mwangangi, earlier in this conversation, the issue of mental health did come up, and I'd just like to bring it back because the truth is that it's just not talked about enough, and it's only during this pandemic that the issue has come to the fore. But a lot of the time when we talk about mental health and assistants and psychologists, that sort of once a child has already suffered their mental issues or they're already going through it. But what can be done to prevent mental health issues in relation to violence against children? Is the ministry able to do anything, or are they doing anything as a preventative measure?
Thank you, Smriti. Indeed, they always say prevention is better than cure, and definitely we need to put in place interventions that try and avoid actually having a child go through an episode of violence, and then of course the mental health repercussions that come with it. So what we are doing as a ministry is we're working to see how can we actually use technology to be able to have the child engage with different applications and able to have messages when it comes to being healthy and living a healthy lifestyle and having well-being interventions around the space of our child. And secondly, when mothers do come to the antenatal care clinic, we actually have developed a purple booklet. We call it the purple booklet. And one of the things that we have included there are issues that deal with the well-being of the mother. We do know if a mother is balanced and is well and is comfortable, then chances are that she's able to then extend that environment for her child and ensure that then her child is protected against violence. And so we do have, teachings which we give to our mothers when they come to the ANC clinics. And even after they deliver and they bring back the children for weight monitoring, for growth monitoring, for immunization services, for any supplementation services, we provide the avenue to be able to really educate the mother on what's going on, in terms of ensuring her child, has the right milestones and is protected. We also do have teachings that we're giving mothers when it comes to being able to have the telltale signs and even being able to have those discussions with their children, being able to identify any early signs of abuse in their children. All these are sort of integrated towards an information pack for our mothers to ensure that our babies and children are protected. I think another very, really important element becomes engagement in the community. Public dialogue is very necessary, and how we are extending this is by collaborating with community-based organizations. These are different organizations that are spread across the community who can really perhaps create platforms where the community feels safe enough to be able to engage and have discussions on violence against children, to have discussions on how to protect children, and even perhaps mechanisms of how issues can be identified early on before they spiral out of control. I think another very important element becomes that of engaging with village elders. Like we've mentioned today, CS Chelugui and Maniza have both mentioned the effect when it comes to social strains, economic strains in the community. And so it becomes important to then create a platform where the community can actually share their frustrations, where the community can actually come forward to, highlight what's going on in their lives, in their family situations. And this can help actually prevent an episode of violence against a child. And so really we do feel family, and perhaps even for this issue, in all forms of violence, from FGM to gender-based violence to sexual assault, there's a very integral role that dialogue plays, a very integral role that the community plays.
Yeah, most definitely. Just on the point that you made earlier in the conversation regarding the employment of, I think it was 47 psychologists. Where are these psychologists located? Are we talking Nairobi Central, or is this one psychologist per county? Because access to mental health care is often a big problem. If we're talking about, half of those psychologists being in Nairobi or Mombasa, for example, how is the child who's in Marsabit expected to get mental help? Dr. Mwangangi? Oh, all right. It seems that we've unfortunately lost Dr. Mwangangi for the moment. All right, Dr. Mwangangi, did you hear me?
I'm here, still here.
Okay, did you hear my question?
Yes, I'm here. Yes, I did. So yes, indeed, like I said earlier, 47 psychologists are by no means enough. And yes, when we did come up with, this establishment, we foresaw the need to have these postings happening across the counties. And so we're talking about one psychologist in each county referral hospital. But that is still not enough. We have 8,000 health facilities across the country. And so what we're doing, which is quite important, is of course, one, increasing on the number of psychologists that we require to be able to extend this. But secondly, also working on our referral system. It is important to note that perhaps, infrastructure may be more robust when it comes to Nairobi, Mombasa, and of course, there are interventions underway to ensure that all counties are at par when it comes to this mental health infrastructure. However, one of the ways in which we can create efficiencies is in having good referral systems and good referral channels. And I'm not just talking about the referral channels in a health facility per se, but also in the collaborative, line ministries. For example, being able to have that, referral channel robust when it comes to meeting the Ministry of Interior, the police officers, the judiciary, and then all the way to advanced tertiary care. You may realize that sometimes some of the cases we see actually require a lot of reconstructive surgery in some young children. And this would then, of course, require the resources and the skill set that are in our referral hospitals. And so our referral mechanism and framework is very, very important, and is one of the ways in which we can stress and we can stretch out the resource of psychologists. I think another important thing to mention, Smithy, is that through COVID-19, mental health has really come to the fore.
Yeah.
And the recruiting of psychologists is just one intervention that we have in play in the health sector when it comes to mental health. We have collaborated with different stakeholders. I'm sure you may be aware that last year the president put together a mental health task force, and this task force was able to deliver their report. And in that task force report, they were able to highlight what Kenyans feel needs to be done when it comes to mental health and ensuring that there's more access to mental health services and that their well-being is actually met. And so what we've done as a Ministry of Health is, through our CES, we've been able to envision a more, diffuse infrastructure for mental health services. The ministry will soon be embarking on putting together perhaps the biggest referral mental health facility in the country. But this time around, not just sort of giving it the brand name of mental health, but integrating well-being. And so we'll have, a new well-being and mental health facility put in place in Karen in the coming year. We also then have subsidiary facilities across the country that will be able to then operate in what we always call a hub and spoke model, to be able to extend the mental health facilities in the country.
Okay, well,
and then of course, additionally.
Yeah, no, I was just going to say it's great to have these investments and these institutions. That, of course, is positive news. But the other issue that comes about is the affordability of these services.
Indeed, you're very correct. And that's why it's very important as we roll out the UHC agenda to ensure that mental health services are actually part of the benefit package. And again, here we have exciting news. The National Hospital Insurance Fund has actually integrated mental health and rehabilitative services as part of the benefit package. And so what this means is that for those Kenyans who are enrolled into the National Hospital Insurance Fund, they will be able to access mental health services. They will be able to access, medications when it comes to mental health. They'll be able to access rehabilitative services.
All right.
Now, for those who are enrolled in NHIF, we're actually rolling out a scheme for poor, vulnerable Kenyans who will be able to get an insurance card that guarantees them access to mental health services.
All right, well, that is good news, and it's something that we will be keeping close tabs on and connect with you on that as and when it happens. All right, Mr. Chelugui, I'm going to come to you in a moment, but Maniza, just first. Education is key. Raising awareness is key. In schools, we haven't focused so much on what can be done in schools and the education sector. Also in communities as well. But communities are not necessarily, and perhaps schools, informed on what to do. Firstly, how to identify cases of violence against children. Then what to do, what action can people take, where can they report these cases? UNICEF has embarked on a campaign as well, but tell us more about how the layman can make a difference in protecting children against violence.
Thanks so much. You know, let me recap a little bit in terms of the impact, because we've been talking a lot about, you know, data and systems and everything. But if you just for a while imagine, you know, being a child, we were all children, and what is an impact of a violent incident to oneself? Apart from perhaps if it's a physical violence, it's the hurt, it's the pain, but there is humiliation. And then if this is repeated, there is low self-worth and self-esteem. And it's actually been shown that children who go through these kinds of cycles of repeated incidences of violence have hampered development in terms of also their learning ability, and they actually perform perhaps poorly, more poorly in education in schools. So it's a vicious cycle. It can lead to very, very low self-esteem, which can lead to mental health issues, which can actually lead to self-harm. So I think it's really important to understand we're talking about, yes, short-term, but also really long-term consequences of what happens, you know, when children are subjected to this kind of violence. I think the other thing we should also talk about is related to not just whether children themselves experience violence, but whether they witness violence. And I think in the survey that CS was mentioning, at least half of the children in this country have witnessed violence at home. And let me just tell you one stark global statistic. You know, we have 1/4 of children worldwide under 5 who live with a mother who experienced intimate partner violence. Now, what kind of a world is that child growing up in? What are they thinking? They're thinking, potentially, that violence is a way to resolve conflicts. And so that stays within them. And what you will see is a pattern, is a cycle, that children who grow up experiencing this kind of violence, repeated violence, think that that's the way. And so when they're adults, they will do the same. So I think it's really important that we understand, if we want a peaceful, non-violent society, we've got to start with a non-violent childhood. So I think it's really important to actually put it out there. In terms of what can the layperson do and how can they spot it, look, Smriti, I think, you know, it's clear, you know, physical violence, beating, slapping a child, shouting, making them feel, you know, as low as, you know, this, bullying, sexual violence. I actually think, you know, almost everybody knows what that is about and what that means. The issue is often we are bystanders. We think it is somebody else's problem. It's fine, let me not interfere, you know, let them take care of it informally, and so on and so forth. And children themselves, actually, the survey shows that you know, very low percentage of girls who have experienced sexual violence actually report it. In fact, I think something like 12 or 13%. That is frighteningly low. Something so profound happens to you, and you as a young girl, you know, don't feel that you have a voice, that you can't say anything. And often because they probably think that nothing will be done about it, they will be blamed, and so on. So I think we've got to really, really start busting those kind of myths and that kind of perception. And in order to do that, one of the things that we've done with the Ministry of Labour and Social Protection is launch this campaign, which is called Spot It, Stop It. Meaning, if you see it, you have a role, you have a responsibility, you have to stop it, and it begins with you. And there is a number there, 116, which is out there, which is a helpline which anybody can call and get support on. And if you're a child and you're not able to get to a phone and do that, talk to a trusted adult. Trusted is an important word. And I think, we've got to get this public information out there. It is not okay. Under no circumstances is it okay to perpetrate any form of violence against children.
All right, Maniza, thank you so much. As you say, it simply is not okay. We are coming to a close of the forum. There's never enough time, but CS Chelugui, at this point, I'd like to ask for your commitment. What is it that you can commit to ensure that violence against children eventually stops? As the CS of the ministry, essentially responsible for the welfare and well-being of children.
Thank you very much, and I continue to thank the speakers also who are in this interview. They are making very informative suggestions, and I really think that as a ministry we appreciate the concern and the collaboration that we continue to experience from these other stakeholders. Now, as a ministry, as I said earlier, we are committed to reduce violence against children by 40% by the year 2023. And we shall do this through various strategies and programs. One of the implementing the violence against children, National Prevention and Response Plan 2019-2023. And as a CS, first is to provide leadership and guidance. And we are going to pursue implementation, especially of the new children's bill, which speaks to all, it's a wholesale approach to protection and or violence against children. The policies that we have put in place, reviewing the same to ensure the realities of today, so that we update the policies of 2010 to the realities of today. I'm going to pursue the enactment of the bill and mobilize all the players in the remaining process, and also develop rules and regulation that supports the implementation of the children's bill. And the other thing is, as I said, review the National Children's Policy 2010 to be in line with the Constitution of Kenya, and also finalizing the National Action Plan on Children Online Protection, which is now progressing very well, and soon we should be engaging stakeholders. And finally, reviewing the Counter-Trafficking in Persons Act, which in a survey done last year, which I launched this year, Kenya has been identified as a source, as a destination, and as a transit country as far as human trafficking is concerned. Right. We want to eliminate this, working together with the anti-trafficking unit in my ministry and the DCI unit on anti-trafficking. We are working on ensuring that we survey, we provide surveillance, equip the unit, and also ensure that all our borders and inside our country, we eliminate the issue of human trafficking. And finally, is to roll the program championed by many partners, You Spot It, You Stop It campaign.
All right, yes, thank you so much for that commitment, much appreciated. I'm afraid we're out of time on the Nation Leadership Forum, but thank you so much to all my guests. With me tonight, Simon Chelugui, the Cabinet Secretary in the Ministry of Labour and Social Protection. Also, Dr. Mercy Mwangangi, the Chief Administrative Secretary at the Ministry of Health, and also the UNICEF representative, Maniza Zaman. As Maniza said, the campaign by UNICEF is on. Spot it, stop it, and you can do so by calling the helpline 116, whether you're a child or an adult, to report any cases of violence against children. All right, that's all we've got time for. Thanks ever so much for watching. I'm Smriti Vidyarthi. Do be sure to stay tuned. Zainab Ismail has NTV Tonight coming up in just a few minutes. Stay tuned.
In Kenya, 1 in 2 children suffer from cavities. Brushing with Pepsodent removes bacteria and repairs tiny holes before they become cavities. Because every smile matters.
Do more to protect yourself and family from viruses that remain on the clothes. Separate laundry that has been exposed and do not shake to minimize the possibility of dispersing the virus through the air. Soaking your laundry in water and hand washing powder does more to kill germs than just a normal wash. After washing, dry your clothes in direct sunlight.
They say we do the expected. We say we're more than you expect. Sunlight, more than you expect.
It's about time we got to work. There we go.
Red Bull gives you wings.
How powerful is